Good evening. Good evening, everyone. I'm Dr. Prasad Kamath. I'm Medical Director of Infigo Eye Care Hospitals. We have a chain of 10 hospitals at present from Boisar, Virar, Palghar, Bhayindar, Borivali, Vashi, and Murbad. These are the hospitals in Mumbai region. And we have hospital in Pune, very good hospital in Pune in Baudan region. And two hospitals in Konkan, that is Ratnagiri and Khed. So today I'm going to talk about cataracts. So cataract, what is cataract first? Cataract is the most common cause of blindness in old age group, and it is the most common cause of blindness today. So what is cataract exactly? So the lens, there is a lens inside our eye. Our eye works like a camera. There is a lens in our eye and there is retina. Like there is a lens in a camera and there is a roll in a camera. Similarly, we have a lens in our eye and there is a retina which acts like a roll of the camera. So now this lens is clear at the time of birth, and now as the person ages, this lens becomes cloudier, and as the lens becomes cloudy, your vision becomes hazy. This is what we call as cataract. The lens in the eye becomes cloudy, whitish. That is called as cataract. So cataract is age-related process. So what are the causes of the cataract? First is age, definitely. Second is diabetes. In diabetics, the cataract appears earlier as compared to normal people. Normally, the cataract develops after age of 60, but in diabetics, it can occur at the age of 40 or 50. Then another type of another cause for cataract is injury. Any type of injury in the eye can lead to development of the cataract at a younger age. Then another cause is steroids. If the patient is in on steroids for any type of condition like asthma or skin problems or arthritis, if you are taken steroids for a long time, then yes, cataract can develop at an early age. Then another type of cataract is congenital cataract. Here it is rare, but it can happen in children also. Like congenital means it can be there in newborn babies. So if the cataract is there, then it has to be operated earliest. Even we have operated 2 to 3 months old children also, because if we delay it, then their eye development will not occur. So these are the causes of cataract. Now, what are the types of cataracts? One is called as immature cataract. See, now this is very important because initially around 15 to 20 years back, the technology was not good enough. So we used to take a large incision and we used to take out the cataract and we used to take stitches in the eye. So that was the old technology. So for that, we used to wait till the cataract matures. But nowadays, with the advancement of the technology, we remove the cataract through an incision of 2.5 millimeters. So we do not wait till the cataract matures. It has to be removed in a stage of immature cataract. So immature cataract means the cataract is not completely cloudy, but yes, it is partially cloudy. It is so that is called what we call as immature cataract. Then there is another type of called cataract which is called as posterior subcapsular cataract, which develops exactly at the center of the eye. This is very common in diabetics and patients taking steroids and injury patients. So this type is called as posterior subcapsular cataract. And when the cataract matures, it is called as mature cataract, where the lens becomes completely cloudy. Ideally, you should not wait till this time. But even with these patients, the visual prognosis is good if we do cataract surgery on time. But if we do not treat even at this stage, at the stage of mature cataract, then the cataract can rupture inside the eye and can lead to glaucoma and permanent loss of vision. So cataract should not be neglected at any cost. So these are the types of cataract. Now, what are the symptoms of cataract? So initially, when the cataract is early, you won't get much symptoms. You will see some colored halos around the street lights or headlights. Okay, then you will get a lot of glare because of the headlights at night. So these are the initial symptoms of cataract. And then gradually, as the lens becomes cloudier, you will see as if you are seeing through fog. The vision becomes foggy. So this is a symptom of the cataract. And when the cataract matures completely, then the vision is lost completely. So these are the symptoms of cataract. There is no pain in the cataract, only vision loss is there. So this is about symptoms. Now, when the patient of cataract comes to us, what we do? First, we check the vision of the patient. Then we check pressure of the eye because many times cataract can be associated with glaucoma. So we check eye pressure. Then again we put drops in the eye and dilate the eye. So for that patient we put drops 3 times at an interval of 5 minutes, and patient has to keep his eyes closed for around 30 to 45 minutes. Once the dilatation effect comes, we see the grade of the cataract. There are grades of the cataract: 1, 2, 3, 4. Grade 4 is the hardest cataract, and grade 1 is the softest cataract. So we see the grade of the cataract on a machine that we have, which is called a slit lamp microscope. Then after that, we check the retina, which is the inner part of the eye, because retina is the most important part of the eye. If the retina is okay, then only you will get good vision after cataract surgery. So retina checkup is definitely necessary before cataract surgery. If the cataract is mature, then we cannot see the retina because cataract is in front of the eye and retina is in the back portion of the eye. So in those cases, we do a test called sonography of the eye to see the condition of the retina if the cataract is mature. So these are the things that we do in our OPD. Then we do a test called as A scan to check the power of the lens that we are going to implant in the eye. So what we do in cataract surgery is we remove the natural lens that is there, which is defective, and we implant a artificial lens. So that is what we do in cataract surgery. So we check the power of the lens by a process called as A scan. So now we have an advanced machine at some of our hospitals, which is called as Anterion, which is more accurate in calculating the lens power. So now there are various types of lenses available after cataract surgery. Now the basic types are monofocal lenses and multifocal lenses. In monofocal lenses, your distance vision will be clear, but for reading you will have to use glasses. While in multifocal lenses, both your distance and near vision will be clear, and there won't be need of glasses for 90 to 95% of the times. Only if you have to read a very small font, you may have to read glasses for like occasionally, but most of the times you will be free of glasses with multifocal lenses. So monofocal lenses and multifocal lenses. So accordingly, the packages are there. Monofocal lenses are comparatively cheaper. Multifocal lenses are costlier. But the thing is, yes, these are the types of lenses that are available. And there are other types of lenses which are called as trifocal lenses. These are the most advanced lenses where both distance, near, and intermediate vision is absolutely clear. So these are those are the highest possible lenses, trifocal lenses. So these are the types of lenses which are available for cataract surgery. So initially, as I told you, now we could come to the procedure of the cataract surgery. So initially we used to take a large incision, we used to take stitches. Nowadays we do a cataract surgery by an advanced technology called as phacoemulsification. So what we do in the surgery is, before that, we do some blood investigations that I forgot to tell. Some blood investigations are done, like we check the hemoglobin of the patient, we do CBC, complete blood count. Then we check the sugar of the patient. If the patient is diabetic, then both fasting and post-lunch sugar has to be done. Then in elderly patient, definitely ECG is also necessary. And we do triple H test, which is called as HIV, hepatitis B, and hepatitis C. So all these blood tests are necessary before cataract surgery. And once the tests are fine, then we post the patient for cataract surgery. We always do cataract surgery in presence of anesthetist. Okay, anesthetists do not do anything. We nowadays, initially we used to give injection around the eye to anesthetize the eye, but nowadays around 90% of the patients we do not give any local anesthesia. We do not give any injection. We just put some drops in the eye to anesthetize the eye. So no injections are required in our hospitals. We do cataract surgery without injections in around 90 to 95% of the cases. Only if the cataract is very hard or the patient is very uncooperative, then only we give some injection around eye. Otherwise, 90 to 95% of the cases, injection is not required. We do cataract surgery in topical anesthesia, just putting drops in the eye. Okay. So now, when the patient is taken to operation theater, first patient's BP, blood pressure is checked, patient is dilated. Then patient is taken to operation theater. We clean the area around the eye and we put a drape, sterile drape on the eye. And then we open the eye with a speculum. Then we take a 2.5 millimeter, 2.5 to 2.8 millimeter incision inside the eye. It's a very small. You can see, imagine, 2.8 is very small. And then with a probe of phacoemulsification, we insert the probe through that incision and we break the cataract in small pieces and we aspirate that through the machine. And then after the cataract is removed, we put a lens inside that. The lens it's a foldable lens. So we fold the lens and we inject it. So it gets unfolded in the eye. So with the same 2.58 millimeter incision, both the cataract can be removed and lens can be implanted. So that is how we do cataract surgery. And cataract surgery is absolutely safe. It takes hardly 15 to 20 minutes. After the surgery, patient can immediately go home. No head bath is recommended for 7 to 10 days. After that, patient can take head bath. Some drops we have to put for a month. But the thing is, the recovery time is just 7 to 10 days. After 10 days, you can resume your work after cataract surgery. And the precautions that need to be taken after cataract surgery is no head bath and goggle we have to use full day. While sleeping also, it is preferable to wear goggles or we give a eye shield to cover the eye. So eye has to be covered during even when we sleep. Then drops have to be implanted very strictly, put very strictly, and we do not open the eye drops with using pin or something. We have to rotate the cap of the eye drop so that the eye drop opens. Okay, the tip of the eye drop should not be like touched with pin, or even your hand should not touch the tip of the eye drop while putting the eye drops in the eye. So these precautions need to be taken, and as I told you, no head bath for 7 to 10 days. That is very important. And the visual recovery is very fast. We generally give the final glass number after 3 to 4 weeks of cataract surgery. Generally, we keep a gap of at least 5 to 7 days between two eyes. If we do operate one eye, then other eye can be operated after a gap of 5 to 7 days. So this is how we can do both eyes together. Advantage of doing both eyes in a gap of 5 to 7 days is we can do both eyes with single blood test. Otherwise, if you keep more gap of more than 1 month, we have to repeat the blood test. So that is one advantage. Then again, for one eye, you have to take precautions for around 10 days. Then for other eye also, you have to take precautions for 10 days. So if you do both eyes in the gap of 5 days, then the time of taking precautions after cataract surgery reduces. So that is advantage of doing both eyes at a gap of 5 to 7 days. We generally recommend that. Uh, Otherwise, cataract surgery is a minor surgery, so there is you should not take any stress about it. It's the most common surgery in the world nowadays. So it's a very minor surgery, and we have experienced cataract surgeons in all our Infigo branches. We generally take surgeons who have done at least 3 to 4,000 cases. So you will definitely be in safe hands. Thank you so much.